Welcome to the Revolution Dentistry Podcast. Welcome, everybody, to a very special episode of the Revolution Dentistry Podcast. We're here with a game-changing dentist, Dr. Sully Sullivan. We're actually at the Closing Institute here in Dallas, Texas this weekend, where he is a keynote speaker, all right, and he is going up on stage this afternoon. Very excited to hear him speak. Thank you so much for joining us today.
Thanks for having me. This is fun. No, I love it. Obviously being a podcaster myself, I'm all about it. So it's great.
And if you guys didn't know, now you know. Dr. Sully Sullivan is actually the host of the Millennial Dentist Podcast.
Check it out.
Yeah, check it out. And he's also a part owner of 3D Dentists.
Yep.
Okay. So can you talk to us a little bit about what it is that you're doing in the industry to innovate, and maybe what you have planned to speak to us about on the stage today?
Yeah, like you guys, I kind of, when I got out of school, I wanted to do it probably different than a lot of the ways that my dad had done it and that dentistry was traditionally done, and so my thing was how can we leverage technology? Mm-hmm. How can we leverage our access to education to really do more, faster, right? It's the work smarter, not harder mentality. And so that was kind of really what I got out and started doing. And so today I'm speaking on, as it pertains to full arch implant dentistry, how can we leverage technology to increase case acceptance?
Okay.
So I'm talking about the Medit and the Medit apps. Medit's a great scanner. It's been a great scanner, but really what they've done now is leverage their software to kind of meet their hardware. And so show some cool ways that data meshes, how we can do digital smile design really quickly.
Okay.
So that's what I'm talking about today, just how we can, because when it comes to full arch and really case acceptance in general, it's no silver bullet.
Yeah.
Right? It's little things that add up to success. And I think that's such a important thing to realize is I think people are searching a lot of times for that silver bullet. And so it's the little things. So hopefully people get some pearls.
Absolutely. I mean, we're all excited to listen and see what we can learn from it. So the Medit apps. Okay. Yep. So can you explain exactly what the Medit app is? I know you kind of touched on it, but how is it helping dentists integrate full arch more seamlessly into their practices?
Yeah, so most people think of a digital scanner as just a digital impression system, right?
Yeah.
I buy the scanner and I get the wand and then I replace analog impressions. And that historically has been the main part of it, right? I mean, CEREC obviously was unique in that we could make crowns with it, but outside of that, most of them were just a way to replace digital impressioning. And so Medit has a whole software side of it where they have apps that you would download no different than you would go on the App Store on Apple and download them. There's ortho simulation, there's smile design, there's some minor CAD software. You can design night guards on one of the apps. And so they have a lot of that's integrated into their system.
Okay.
So as it pertains to full arch, probably the one that I use the most is how we mesh data. So in digital workflows with full arch, we're always trying to replicate what the patient had,
right,
or at least where those teeth were in their face,
right, and
then bring that back to where post-surgery now all the teeth are gone. How do I get back to knowing where to design teeth in the face?
Okay.
And so their meshing software is really good so that the dentist, when they send it to the lab, they already know, hey, my data is good. Right. And if I send good data, typically we get good data output, right?
Absolutely. Okay. Well, that sounds like, pretty innovative. I haven't really heard of something like that before where it's an all-in-one.
Right.
And it gives you a lot of different options, it sounds like. So you're not stuck with just one. You can try out several.
Well, I think a lot of the manufacturers have realized that now the hardware is all good, right? If you get, for a while, maybe 10 years ago, there was a significant distance between this scanner and this scanner. Well, now you've got, Prime Scan's great, Medit's great, Trios is great, iTero is great. They're all good. And so what's going to be the differentiator ultimately will be software, I think, more.
Okay.
So
No, that's
how
a
you
great
leverage
point.
that software is where you get a lot of the value out of the scanners.
Okay, that's incredible. All right, and so now pivoting a little bit to some of the other passions that you have.
Yeah.
You do a lot of work with dentists in helping them integrate successfully practice ownership principles.
Yeah.
And as well, I know that you're a part owner of 3D Dentists, and you guys have a lot of different courses of not just 3D, but of all sorts.
Yeah.
So what is your passion when it comes to helping dentists learn about the business principles and the clinical workflow principles?
Oh, that's a great question. We could talk about that a long time. No, I mean, ultimately, like I say, so I graduated in 2015, and I wanted to be an owner, right? And so like, I believe in practice ownership. Like, I think that group practice and DSOs have a place, but like, I loved the idea of being able to really cultivate, control, and build the practice the way that I wanted to do things. So, I think the challenge we have in our industry today, though, is it's competitive. Like, it's expensive to do that. And most dentists, the strategy to grow and get better is just to keep adding clinical things to their skill set. And it's a great way to grow, but it's limiting. Meaning like, okay, I'm a dentist. I'm going to go out. I'm going to learn how to do root canals. I'm going to go out and do implants. I'm going to go learn to do full arch. They go and learn how to do all these things, but then they don't necessarily bring along their how they leverage technology, right? So like, technology can make dentistry more profitable for you. It can make it more affordable for the patient. So like, how do I leverage technology to drive my costs down to where I can get better case acceptance?
Right.
And I think on that side of things, what people don't realize is that their buying process is flawed. Right. Meaning they're trying to sell and get people to say yes to dentistry that is expensive. And most patients can't walk in and stroke a check for $2,000, $3,000, and we don't have a buying process in place as an industry to get people over that hump.
Right.
You see it more here because it's big case dentistry, meaning like financing and things like that. But generally speaking, if we were to ask, like, poll the audience and say, hey, how much of your dentistry is financed over a yearly basis, it's going to be less than 5%.
Right.
And what it'd be like a car dealership that didn't offer financing. Like, that would be a very
bizarre.
They would not be in business very long. So we work with dentists and trying to help them level up their clinical skill set. We do live patient programs where you can come and learn to do implants, those kind of things. Right. We leverage technology as well. So exocad, 3D printing. We work with Sprint Ray. And then our kind of our flagship program is our mastermind program, where we talk about all these coaching and business concepts.
Yeah, so staying on the topic of technology,
Yeah.
as you know, it's always evolving and new technology is always coming out. So how do you keep yourself in line or updated with all the new developments and trends in technology?
Well, it's hard, and honestly, like, look, it's like, I think the real answer is there's a lot of marketing out there too, right? So it's hard to wade through what is going to be impactful and what's not impactful.
Right.
Honestly, I think one of the best things that I did early in my career was I found people who practiced like I wanted to practice and were successful, and then I just tried to replicate what they were doing. I didn't try to reinvent the wheel. I think the hard part about today is there's so much noise, and what I mean by that is, like, you can post a question on Facebook, what's the best scanner? Well, you're gonna get so many different biased opinions, and you have no idea,
right.
Do they do the same dentistry I do? Do they even make money? Are they profitable? Are they successful? How many days a week do they work? Do they take insurance? Do they not? You see how it's so hard to take advice from somebody. And so, honestly, what I think has helped me wade through, like, all the technology is, one, finding people that are successful with it. Okay. And what I'll tell you is like, now I'm on the other side of it, right? Like, I'm the guy who's like trying to troubleshoot and beta test all this stuff, is that there's a lot of stuff that's not ready, but it comes to market too soon. And it's hard. So I think you got to always ask, like, okay, step back unemotionally and say, are there people using this at some level of scale where it's not just on Instagram?
Right.
It's not just on Facebook. It's not just, let me show you one case where I did it one time.
It's a proven model.
But does it really work? Yeah.
Right. Okay. No, that really helps. It's great advice for helping someone differentiate between what's maybe trendy.
Exactly.
And what's proven.
Like, y'all don't, like, I can make one case on Instagram look really cool and be like, oh my gosh, I should go get this. But you don't even know if, like, what if that required like 4 hours of work for that one case, and like that's not realistic in and day out busy practice.
No, it's not. And so you're saying that you guys at 3D Dentists help people differentiate what's trendy versus what's proven.
Yeah, we try to vet it, right?
And
so that like our practice has 6 dentists, 35 employees, one location. So like, we're a big operation.
Very big.
So it's got to work. It can't just work in my hands. So whatever we integrate has to go through kind of a vetting process to know, okay, it's going to work with this person, this team member, this doctor. it's not just a one-off like, oh, look what I did, it was cool.
Yeah.
And I think we're seeing a lot of that right now. Is we're seeing a lot of stuff that's really trendy, to your point,
right,
get posted to kind of like for the shock and awe value of it.
Yeah.
And then we want to go get into it without even really appreciating maybe the work that goes into it.
Right. And people are trying to push a profit, make a quick buck.
That's marketing. Yeah.
Yeah.
It's good marketing.
Unfortunately, sometimes.
I mean, yeah, exactly.
So yeah, you got to be careful, and I totally agree with you. So, what would be now? Let's talk to a dentist who is maybe new to practice ownership, maybe trying to get into practice ownership, you know, and they're unsure, they're afraid. They are like, oh my gosh, the risk, where do I go to learn this kind of stuff, marketing, you know, whatever, business principles, clinical, they want to improve their clinical piece. What would be your biggest piece of advice to somebody in that position?
Well, that, again, a loaded question. And I'm biased, obviously, because we have education. So
yes,
we would love to see people at 3D Dentists.
Of
but
course.
There's amazing education in a lot of places. But no, I think I'll go back to kind of what I mentioned. I kind of touched on it earlier in that, like, y'all know that saying that you're the sum of the 5 people you hang out with?
Yes.
You know, I really do believe that. And I think that's what you have to do is when you see people that you want to be like, you got to follow them, you got to invest them. I mean, like, y'all are doing a great job of that, right? You got a podcast, people want to be like you guys. Like, they want to listen to the podcast, listen to the content, and the idea is you just got to be one step ahead, right? Like leadership is being one step ahead and then being able to help someone get to that next step.
Exactly.
Ultimately.
Exactly.
And so I think that my biggest advice, the thing that has helped me be the most successful, was just I surrounded myself with people that were doing what I wanted to do, and I was relentless in basically being the squeaky wheel. You know, I showed up, I put the work in, I would message people.
Deeply.
You just be the squeaky wheel. And I think in this day and age, it's too easy to sit behind a computer screen and do online CE and not engage, be a listener but not an engager. And so I think that is a big differentiator. Is like, if you want to be great, then you've got to engage beyond a digital level. You got to get to stuff like this.
Absolutely, absolutely. And something big on this podcast is mentorship, right? Finding those people to help you in the start. So with that being said, if someone wanted to reach out to you to learn more about your technology or your education services, where could they find you at?
I mean, probably the best place is Instagram, ironically. I'm pretty active on Instagram. So I'm at Millennial Dentist. Millennials can't spell millennial. It's 2 L's and 2 N's, just to be clear. But yeah, at Millennial Dentist. My email is millennialdentist@gmail.com. So you're welcome to email me as well. Those are really the best ways to connect. And I'll tell you, we have a cool thing that I would like to share.
Of course.
A big initiative we had last year at 3D Dentist was trying to just develop a space for our community to come and be at that was free, without the drama of Facebook groups, etc.
Absolutely.
So we created an app. So you know, on the Apple Store, Android Store, or Google Play, whatever, we have an app. It's the 3D Dentist app. So you can just search it in the App Store. It's free, and we have a ton of just awesome free content on there where you can post, you can read what people are doing. There's we do free webinars. There's some actual like video course content on there that you can actually get to. So it's a cool space where, like I said, if you want to engage and you want to start to get into community like that, that's a great place for us to do it.
Awesome, awesome. I love that. So you guys heard it here, the 3D Dentist app.
That's right.
Buy it, check it out. Guys, this has been...
It's free. You had to buy it. It's free.
It's free. It's free.
It's the best buy ever.
Best buy ever, exactly.
$3.99.
Yes, exactly.
Hey, super appreciate you coming on here, Sully. This has been great.
Yeah, thanks for letting me on. And I love what you guys are doing. Like, I was you guys not so long ago. So I love what y'all are doing, and I think it's great. So
awesome.
We need more of it.
Yeah. Hey, so thank you for tuning in to the Revolution Dentistry podcast. We're here every week to help you grow, and we'll see you next time.